physiology and also anatomy physiology is maximum different each other, right? Two different concepts here. One is the anatomical physiological aspect to study about the kidneys are different from the TCM physiology, because I don't want to repeat again about the anatomy physiological aspect. Already we were completed that portion, but now we'll try to understand about the how different from the modern medicine to the Eastern medicine. Now we are based on the traditional Chinese medicine, all the traditional medicines, all the folk medicines, all the indigenous medicines, all the native medicines, all the most of the integrated medicines are known as a Eastern medicine. Modern medicine, allopathy medicine, Western medicine, all are connected to the English medicines, right? So now we understand about the TCM physiology of the kidney meridian, store the essence and govern the birth, growth, reproduction and development. This is in fact I love to tell you all the time, which the kidney is one kidney. We, according to the modern medicine, two kidneys. As per the TCM physiology, one kidney. Left kidney is the proper kidney. Right kidney to be known as a gate of vitality. So right kidney, it stores the essence. When you look at about the parents, forefathers, through them we are here. Their essence is good. Their right kidney essence were good. So our essence of the kidney also good. The essence, something is resonance. Professor said it is a resonance. It is indicating that as per my understanding and recognition, the essence is nothing but is the semen and sperm. Semen is different from the sperm, but sperm quality under the semen, that should be nourished. The good quality of the sperms to be known as a essence. That essence are stored in the right kidney. Then what are the function of the left kidney? Of course, we try to understand both, but still according to the TCM, we are giving the more enthusiasm to understand about the renal system, especially with the support of the right kidney is more predominant and significant. So therefore it is the essence which we called as a, for the woman is ovum, for the men it is sperm. So now collectively known as a essence. Both are required. There is a growth, reproduction, development, sexual organs, the male and then female organs to develop that. It is required together. That essence is there. Of course, normally I believe myself to understand in the greater way, when we should have healthy, then our essence also should be healthy. If our essence should be healthy, then what we derived, inherited from the parents, that also should be healthy. When they are good enough to give the essence to the fetus, then the fetus growth will be normally good, called as a prenatal energy. That's called as a pre-essence, then the post-essence energy. This is in fact is inherited energy, right? And a pre-inherited energy. This is in fact is deriving from the parents only. Great parents, then parents, from that it's coming to us. So if we nourished precisely with them, then the whole pregnancy will be good. Then you don't feel sick much all the time. It's not that abortion or the miscarriage or termination, the words DNC, all these things to be done, because in case of course there is any emergency, that is something is different, but once conceived, then doing the miscarriage is natural, abortion is unnatural, shouldn't do that. But if we have to keep it that precisely is the good conception till our 9 months, then you understand that always you have derived is the good essence. So the period once you got the conception, at the same time implantation to be taken place, and then further every month there are the changes in the pregnancy. So once in the 9 months completed, you are not sick much, and the movements are good, and the growth is good of the fetus, and certainly then you understand may not required more number of the medications, like you take calcium, folic acid and magnesium medication or something like that. So it's not much required. So when you take it as a nourishment through the food itself, that abundantly good for one pregnancy. So once completed this procedure, so once you will get the normal delivery, so after that you have the desire to feed the child at least 2 years, that also to be known as is the chi of the mother of the essence. The essence you got it from the parents, given to the fetus, and from the fetus you have given to your child after the birth, and immediately that great essence to be given to the child in the form of the nutrition, and that's known as is the mother's milk, cannot be replaced with any kind of the food. So therefore that also to be known as a essence, but that essence is store essence is the right kidney, and this essence is the second essence is stored in the breast, where the lactiferous ducts are there. Through the ducts is stored the essence, and after the delivery, then certainly the baby suck, the areola will open the through the nipples to provide the essence to the child. So if these parameters are good, then you understand at the time of the conception and then till delivery, you have nourished the food to the through the placenta, you have nourished to the child, and after the birth 2 years you nourish it to the child with the breast milk. Then you understand, really I am telling you, without taking much antibiotics, without taking much medications by the mother, and then if the child is grown up, then till their last breath they are healthy. So this is in fact is the secret which I understand based on the respective traditional medicine. So therefore it is required, try to save this, try to be and try to regulate our health in the normal living way. If we interrupt, we shouldn't create the problem ourselves during the pregnancy, after the delivery. So we try to change, create the problem sometimes that will leads to the problem of ourselves and also to the child as well. So therefore make sure that shouldn't happen anything. No, we shouldn't create any kind of the problem. So hopefully you understand about the essence, and we'll move on to the govern the birth. Birth, I told you, the good quality of the essence. Growth is required. Today, even last day I have seen one particular child that is 1.5 years old, and where I couldn't understand the whole concept about that child in the beginning. Otherwise I'll see that immediately I'll catch the problem, what is the pathological defect. But I took around 10 minutes to understand that child, what exactly that child. So then when they told me, they brought in front of me, I understand there is the central nervous system disorder, but still I tried to understand more about that. But later I just seen the entire, the standing and then back and then hip region, spinal cord, neck erection, hip sitting and then legs movements and all. Then I understand there is some malnourishment of the brain. So where exactly sometimes is the atrophy of the brain, especially the cerebellum having the atrophy, which leads to the problem of the child. Now you understand about the growth and development. So this is in fact is based on the perspective of the renal system. The kidneys are not only governing to the renal system or the water, 90% of the water metabolism, 99% of the water metabolism to be taken place by the renal system. 1% will be excretion of the urine to be taken place, right? So now you understand the growth and development to be taken place with the renal system, because we all know that the bones are regulated by the kidneys. The bones or the skeletal system are controlled and regulated by the renal system, that is especially kidneys. So now based on that perspective, at the same time to understand about the overall the physical structure, can't sit properly 1.5 year old baby, then I understand there is a curvature, there is already curve is there on the spinal cord, there is a more curve on the spinal cord, especially on the vertebrae. So then I recognize that the problem is there are the not on the lower extremities, the problem is on the lower extremities, the manifestation is there, but the causative factor or the pathology and etiology to be known as a brain and then a spinal cord. Then I told them it is the delayed milestone, is not that cerebral palsy child, it's not the Down syndrome child, it is not related to the muscular dystrophy. Then I have checked about I got something to MD problem, DMD, Duchenne's muscular dystrophy, but then I understand they have brought the report. So that report shown me CPK, creatine phosphokinase, is 200. If it goes greater than 1000, 2000, 3000 range, that to be known as a muscular dystrophy. But the muscles are very rigidity, stiffness on the lower extremities. Then I recognized it could be muscular dystrophy. Then after seeing the report, I got clarity, there is no touch wood, there is no muscular dystrophy. If it even yesterday only I have seen another one patient to be known as a muscular dystrophy, the age is 15 years old. The person is coming for the last few years, maybe a year or two. So that particular child, he couldn't walk properly. Yesterday I have seen, I left for 40 days without treatment. Now he is can't walk now. Then I told this will be the last treatment of mine for him, and further I don't recommend to go for any kind of the treatment to him. Muscular dystrophy, there is no proper treatment and not required any kind of the treatment. Don't spend time for the treatments and don't take the efforts to treat for him, and getting it to down and then taking back is not super simple. He stays in first floor and weight is around 40-50 kgs. To getting down it's a super difficult. So therefore I recommended give the happiness maximum to him, whatever he wanted to eat. Before I told him not to give the junk food, chocolates, ice creams or bakery foods, but now I told him whatever he wanted to eat, let them eat. Because I understand now the situation is not that, so what exactly? In the last 2 years I maintained him to sustain in the same level. So we we have seen that now it's a great difficulty. Then I have given the lifespan mostly 5 years. So then more than 5 years he don't survive. So in that case I just put it a word indirectly, you just give the service to him at least 5 years, I told. So 15 years now, another 5 years is the mode of the duration. So that 20 years, 18 to 20 years the muscular dystrophy child will survive. Later they'll go to the heaven. Right. So therefore, now why I wanted to make them to spend? Then they also abusing to the child, stand, sit, go, come, hold yourself and then stand yourself, something they will create the problems. So that's the reason I told, please don't do anything like that. So therefore I understand, so we have not given any kind of the treatment, not to be given for him, may not be required. Why I mean to say, the growth and development to be taken place precisely by the renal system itself. When the skeletal system is good, then you understand the muscular system is good. When the muscles are good, that's opposed to the tendons. When the tendons are good, that's opposed to the cartilage. When the cartilages are good, that's opposed to the bones. The bones are good, that's opposed to the bone marrow. When the bone marrow is good, the blood production is good. When the blood production is good, then the brain function also good. So therefore everything is integrated. Everything is integrated. So therefore the growth is not there, then is not related to the only the brain. Of course it is kidneys also indirectly connected to the brain. When again I'll talk about the other physiology, how it is connected, I'll try to tell you. Then that there is a development. Every stages, every 3 months there is a stages is there. So that stages to be followed precisely. So that 1 year, of course, at least he can scroll in 6 months, and 1 year he should stand, and then 1.5 years he should walk precisely, and also should talk. Right. Should start talking. If it is not there, somewhere there is a milestone is there. So which is, then I was checking whether after the birth immediately he cried. Then they said it took 2 minutes. Then I understand there is the hypoxia that particular time where the less oxygen supplied to the brain, which leads to this problem. Right? Instantly there is called as a cosmic energy, environmental energy, the air energy or the prana energy that should be reached to the central nervous system. After reaching to the pulmonary system, immediately should reach to the central nervous system. If that get delayed, that leads to these problems. By the way, she don't have the epileptic fits. But now we are convulsions. But development, you understand, anything development is there that get the malnutrition, then you understand, try to treat for which organ? Kidneys, should treat for the kidneys. And also reproduction to be taken place. What the reproduction? Especially the male and then female fertility to be taken place precisely. When the men having the right semen quality and then quantity, the morphology and characteristics is good, then you understand their essence also good, and that should be reproduction also good. Even yesterday I have seen the person is around 60 years old, the woman is nearly 46, she told me 46 years old, then they wanted to conceive now. They have married life is 17 years and they wanted to get into the child now. That's what actually they told yesterday. Then I have told them, did you do the semen analysis? He said no, at the age of around 60 years. You just imagine all these things, but not happen. The reproduction, then it is the essence of the, then I told female came for the treatment. The lady I told, rather than you first required the treatment for him, it's not for you. First we check about your morphology, the semen quality and then quantity. The quantity is good, the liquefaction, the essence, that's called as the suspension, the concentration of the sperm, concentration of the semen should be there. So only the liquid or kind of the syrup of the semen is there, so that there is no quality of the sperms. Then how is it possible? So all are connected to the parent should give to the child, and then child should develop. Of course, after the, as I told you, 2 months mother feeds. So after the 2 months, it is essential. After the 2 months, it is essential to develop with the support of the good nourishment or the good rich food. So if we take it that level, then certainly that develop properly. Of course, till our last breath, we don't get sick and we don't get the problems related to the chronic diseases or the non-curable diseases that will not affect to the body system. Okay. Now they produce the marrow, fill up the brain and controls the bones. Now you look at about the produce the marrow. I love this. Fill up the brain and control the bones. The marrow is to be known as a, we all know there is the 2 marrows. One is the yellow marrow, the other one is the red marrow. Both are essential for the production of the white blood corpuscles and red blood corpuscles. WBCs, RBCs to be developed with the support of this bone marrow. Right. So produces the marrow. Marrow here is, I wanted to tell you in 2 ways. One is the bone marrow. The other one is the sea of the marrow. First one is, as I told you, the skeletal system. Any skeletal related problem, any bone related problem, whether there is the deficiency of the kidney leads to that problem, or the excessive physiological function of the kidneys causing the bone related problem. For example, when there is the deficiency of the bone, that's called as a bones pain, or the weakness of the bones, or there is called as a malnourishment of the bone, all are connected to the, for example, osteoarthritis of the knee, are related to the bones, that's called as a osteophytes of the bone, all are connected to the deficiency of the bones. Whereas in the excessive function of the kidneys, to be known as a, for example, spur. Spur is the calcaneal spur, or the bone growth and development. Somewhere is the overgrowth is there, so which is not required. The calcaneal bone is overgrowth, the shoulder bone is overgrowth, or there is the knee bone, somewhere it is overgrowth. Right. So back related problem is the predominant of the bones. So that particular time it is the hyperfunction of the renal system which leads to the excessive growth of the bone system. So therefore we have to minimize the energy of the kidneys, where it is required the energy to the kidneys to strengthen the bone system. Both are slightly different. We try to focus and understand. But now producing the marrow, that means is the bone marrow, it's really essential to our human system. When the hemoglobin is very weak, the anemia or the iron deficiency anemia, the numerous types of the anemia, sickle cell anemia is the very dangerous, iron deficiency anemia, all can be treatable. This particular time what is required? The bone marrow should produce the enough quality of the marrow that's required to produce the blood cells. No doubt the spleen produces the white blood corpuscles, the kidneys produces the red blood corpuscles. Both are required. But here is, of course, according to the producing the marrow, but red marrow and then yellow marrow, both are required to strengthen our hemoglobin level. So that one particular point is there. So that is known as a, which point? I think seniors can highlight that particular point. To produce the marrow, which is the best one single point to treat for the bone marrow?
K6.
Sorry?
K6.
Good, K6. Then? Which is the bone marrow point in our body? I think seniors know very well.
GB39.
Wonderful. The influential point for the bone marrow is specific tissue of the bone marrow to be treatable by using the gallbladder GB39 point, that's called as a Swang Su. That is 3 chun proximal to the lateral malleolus, midway between the two muscles or the two tendons, that's the peroneus longus and then peroneus brevis tendons. Right. So these are the one particular point is really essential. If the people who are wanted to nourish our body, you ask them to develop that regularly, they can activate GB39 in order to increase the immunity in our body. So once immunity is good, that can fight to the more pathogens. I recommend it to all of you. So we activate the GB39, that always is good, right? This is one thing. And the second marrow to be known as a sea of the marrow. The sea of the marrow to be known as a brine, right? So this is in fact is the marrow. There are the two marrows. They produce the bone marrow is the different, and then the sea of the marrow is the different. That is strengthening to the vascular system, strengthening to the circulatory system, strengthening to the nervous system, right? So this particular GB39 also helpful. Wanted water, Ashwini?
No.
Okay. Wanted to strengthen the brain function, that also essential. Do you know there is a distal point for the nape and then occipital region? The distal point for the neck and occipital region, the point to be known as a GB39 as well. So that will support to the vertebral artery. When the vertebral artery is good, that's supposed to the occipital artery. When the occipital arteries are good, that's supposed to the cerebral arteries. When the cerebral arteries are good, then the cerebral communicating arteries are good. When those arteries are good, the circle of Willis is good. When the circle of Willis in the brain is good, it supplies to the entire system of the scalp, precisely to nourish the whole head. So therefore it produces the marrow, right? The bone and then kidneys produces the sea of the marrow also. But the sea of the marrow, there is another point to be known as a Su-hai. Su-hai, it's indicating spleen 10. Spleen 10. The Su means is the blood. Hai means is like a ocean. The blood of the ocean, right? The existing on the one particular place, that's called as a spleen 10, which is located on the 2 chun proximal to the medial end of the patella and 1 finger breadth inferior to that particular area, to be known as a spleen 10. Is a very amazing point. Any blood related disorders, keep it in your mind. There are the 3 points I wanted to tell you about the blood. The 1 point to be known as a GB39, second point to be known as a spleen 10, third point to be known as a K-SHU, that is UB17. If you strengthen these 3 points, of course, hypertension, diabetes, thyroid and malignant diseases, anything connected to the chronic diseases, you name it, you can use it, this particular point. So therefore 3 points are really amazing. I love this point to treat for the numerous diseases. Even you can try all these 3 points. Fill up the brine. How this will fill up the brine? Fill up the brine. Right now we wanted to treat each and every time, try to keep it in the mind. When we wanted to treat the patient, only one single point or any protocol, don't observe all those things. Try to keep the concept inside. That certainly will be helpful, not today but tomorrow. fill up the brain related problem, not only treating by the produce of the marrow or with the support of the kidneys are one support. Apart from that, I think the pericardium meridian were completed last week by Dr. Mirza Awais, I believe. The pericardium meridian are connected to the purely nervous system. So circulatory system are regulated by the cardiac system, heart, and the nervous system is regulated by the pericardium. The pericardium, the word is not only the outer covering layer of the heart, of course that is named by the modern medicine. The pericardium word has been given thousands of years ago. That means that is connected to the brain. Professor Park Jawu is initiated that pericardium, known as a brain, is a supercomputer in the world to be known as a pericardium. The pericardium meridian totally having the 9 points: Tianchi, Chuza, then Siemen, Chianchi, Nikuan, Taling, Laokung, Chungchung. There are the 9 points of the pericardium meridian. Those points are amazing point to treat for the nervous system disorders. So such a wonderful amazing points. Hopefully you can look about I have uploaded some of the points of the pericardium with the deeper knowledge. Even you can see that. So now the pericardium also essential. Shall I apply few needles? आप लेकर आ जाइए needles, everything you just bring here and keep it, whatever required. Meridians are integratedly, you can treat for the brain functions, to regulate the brain activities. Right, sir, how many meridian we need to integrate it? But of course, where the crossing on the scalp, how to understand? Now the thyroid problem is there. So which meridian crosses on the thyroid gland? Try to understand. There is the Renma is the circulating, and then the Yang Ming of the foot meridian is circulating on that meridian. Of course, the supportive meridian to be known as a hand Yang Ming meridian, that is the large intestine. Treat for the stomach meridian to treat for the thyroid related disorders. When the brain is functioning as a Ching Ming San Zo Mi Ching Chu Chai Wu Chu Cheng Guang Lo Chu Tong Tian Yu Sen Tian Zo, 10 points are there, UB meridian points. So that is crossing this points. Then you understand, treat for the urinary bladder meridian also. When we understand about the Tung Silio, Hanyan, Huanlo, Swanli, Chubin, Shuekut, and then Fengch, these are the gallbladder meridian points. Start from here, crossing this line, and then goes to the behind of the scalp. Then you understand the gallbladder also regulating to the brain. According to the theoretical aspect, the pericardium is, it starts from the chest and ends on the middle finger. Then from here to here, then how it is regulating? There is a connectivity, interior connectivity. When the mind is good, when the heart is good, when the hardware is good, then software also good. Right. So therefore there is interior connectivity is there. So therefore it is directly, indirectly connected to the brain. Then fill up the brain with the good essence, and also called as a marrow. That marrow also kind of the essence. Essence is kind of the purified energy. How there is the egg. Egg is the essence. The inside the egg yolk. Yolk is the great essence. The white color is the supportive. Right. Likewise, that through that only there is a growth and development. So therefore, there is a fill up with the brain. The blood is filling with the brain, and also there is a essence, also marrow also filling with the brain. And also it controls the bones as well. As you know, wherever there is a problem, the muscles are controlled by the spleen, the liver is controlled by the tendons, the liver is controlling to the tendons, and the kidneys are controlling to the bones, and then the lungs are controlling to the skin, the heart is controlling to the circulatory system, the pericardium is controlling to the regulating to the nervous system, so on. So therefore, whenever we understand about the bones, we try to understand about the kidneys, right? Now governing the water, the third physiology to be known as a, I think hopefully everybody is understanding in the Zoom. Please comment yes or no.
Yes, sir.
Yes.
Yes, sir.
Good. So any doubt is there, and please you just ask me eventually when we give the time for the question and answers. Into the water is the third physiology. Water absorption. You look at about the, we consume the water. Alhamdulillah. Now I took 100 ml of the water approximately, right? So this 100 ml of the water, maximum it will absorb in the body. If it won't absorb, then my bladder capacity is 600 to 700 ml. Then the urge comes in 300 ml. From the morning to now I had maximum water, then I cannot sit greater than 1 hour here. I should rush to the washroom. So therefore it is absorbing maximum level of the water. So therefore if it won't absorb the kidneys, then the polyuria, dysuria, enuresis, nocturnal emission, spermatoria, all these things which leads to the problems. Then of course is the sweating, the hyperhidrosis. When the sweating also required to come. So if the skin pores controlled by the two organs, one is lungs, the other one is the kidneys. So that's required, how the defensive mechanism is required to control our skin. Otherwise the sebaceous glands open, then everything, the water comes out through our body. Then you cannot sit like this. So how the Almighty God created this body as a complex system, and this is absorbing the water and also regulating the water level precisely. How much water to be detoxified, how much water to be purified, how much water to be excreted through the urine. This is very imperative. When the diabetes patient having the diabetes insipidus, where very oftenly they go for the urination, especially in the night time, and women, especially the girls also, when having the vulvitis or the inflammation of the pelvic organs, also oftenly they pass for the urination. Why is it so? Because there is the water, the retention is not there, absorption is not there, which leads to this problem. Then you understand anything, the urine related problem, the perspiration or the sweating or the hydrosis problem, all are connected to the renal system. When the maximum water metabolism, that means is the glomerular filtration rate to be taken place, or the 70 million tubules are there in the kidney, and then 1 million nephrons are there in one renal system, right? In this way, so many physiological aspects of the kidneys. So that kidneys to be regulated precisely, that means is the regulating the water to be taken place. Whatever you consume the water, so that water is absorption to be taken place, and then the remaining to be excreted through the urine, and also the blood purification, water purification to be taken place through the renal system, especially the kidneys. Please be seated here, yeah. Just keep it away. Yes, sir. So the superior point for the throat issues, especially as a local point to be known as a Tian Tu. This point to be known as a Tian Tu. Now we try to understand, slightly uplift, not totally, semi, yes. Now try to find out the one particular area to be known as a suprasternal fossa. Sternum. This is the sternum. This is the supra. Supra means is superior. Sternum is the sternum. Fossa means is the hollow. So that particular area, just I insert one needle without touching to the trachea, without touching to the windpipe. You just take the deep breath slowly. Just take deep breath. Yes, good. I just applied the 3 needles at a time. In one particular point, 3 needles at a time I have given to that particular area. 1 needle also enough. Why we should apply 3 needles here? But it's my fascinating to cover the entire area and also having the synergy effect. Right? So therefore, did you get much pain, or what is your experience? Tell me.
No pain, sir.
Huh?
Just a prick it was.
So now 3 needles at a time is without much pain is not, that is kind of the art technique, right? In this way, without, this is experienced acupuncturist only should be pierced. This is a slightly oblique direction, not the perpendicular direction, oblique direction, and then that is going down towards the trachea, anterior to the trachea, right? So windpipe, which we called as a, this is kind of the hoarseness of the voice, or related to the trachea, the windpipe, and then the upper part of the pharynx. The pharynx, and between this particular point is good point to treat for the throat related and also lungs related disorders. Where are you feeling the vibration?
Here.
Hand?
And also.
So I am giving the vibration on the needle, but she also feeling the sensation on the lichu. Lichu means lung point. LU7. LU7, I don't want to apply the needle here. Even I can apply, but she is feeling the, you can show the hand. So I just applied on LU7 my finger, and I am just giving the stimulation on the Tiantu point. You can feel the vibration. But the radial artery is getting the circulation. Radial artery is getting the vibration. As of now, these 2 points are enough. Hopefully, I don't want to further apply needles. Please be seated. Yeah. Let it be there for some time. While talking or swallowing the saliva, do you have pain?
Not
No, not now.
cough is
No, I am asking you because of the needle insertion. When the swallowing the saliva will get difficulty. When we inserted the very deeper level, do you feel it's not like that? Then you are safe. You can place it for as much as possible. At least 1 hour, 2 hours, 3 hours you wanted to keep these needles, you can keep it, there is no harm. At the same time, the point to be known as a Shanzang. Shanzang is the Ren 17. So these 2 points, if the person who are not comfortable to apply the needle, there is the equivalent or the complementary or the supplementary another point to be known as a Shanzang, midway between the 2 nipples on the sternum region, apply downwards direction. I will show you that how to do the embedding therapy on this particular region. That is also possible for respiratory disorders. Then we wanted to understand about the open into the ears. The another function to be known as a open into the ears. Then the ears are controlled by the kidneys. Eyes are controlled by the liver. The nose is controlled by lungs. The tongue is controlled by, the lips are controlled by, mouth is controlled by stomach and spleen. Right? Then the entire sense organs are connected to our internal organs. You look at about the organ, the doctrine of signature says that the replica of the internal organs and then sense organs is more or less similar. So therefore, the ears, you look at about the bean, you look at about the kidney, so all these things are same. So therefore, it is required when it is connected interiorly, through the interior energy pathways are communicating to the renal system, to the ear system. When we understand anything connected to the ears, that particular time it is essential, especially for the children who having the deafness or the any ear related problem like a pain in the ears or the otalgia, to be known as a pain. Otitis media is inflammation on otitis, otalgia, otitis media, otorium, some kind of the pus formation. All are related to the kidney infection or the ear infection. Is not totally is the kidney infection, acute problem, somewhere it is connected to that. The external manifestation, there are the two ways you understand. When the patient is coming to you for the pus formation in the ears, so that time the pus is slightly coming out, then you shouldn't say there is a problem is in your kidney. Right? There is an infection or inflammation in the kidney. There is an external manifestation is different from the internal manifestation. The internal pathology is different from the external pathology. So now the problem is in the ears. Then you understand it is connected to the what could be the reason to cause this problem. You try to check with them patient, then they says the wind get excessiveness or there is some kind of, because very sweetly we just apply the buds inside the ear. Once we apply, we feel the sweet taste. राइट हाँ कितना मज़ा आ रहा है, कितना मज़ा आ रहा है, और थोड़ा अंदर जाने दीजिए, और थोड़ा और अच्छा मज़ा लगता है, और थोड़ा इतना वी टचेस, दैट मीन्स इट टचेस टू द middle ear connected to the membrane to be known as a tympanic. So once we touches to that membrane, that leads to the rupture sometimes, that causing the tinnitus. Right? So therefore we try to understand if the problem is created by ourselves or created by the environment, not by the pathology of the kidneys. Internal visceral organs are different from the external manifestation. Always keep it in the mind. Then I told you sometimes maybe the hair fall is there, then the kidney problem, kidney deficiency causes, then you should say for the hair fall kidneys are weak. Then ear problem you say kidneys are weak. Here the TCM says is the kidneys chi is deficiency, kidneys su is deficiency, kidneys chin ye is deficiency, leads to that problem. It's not that the kidneys are that's pathologically deficiency, is not like that. You understand? So therefore is the external problem leads to this issue, then that to be treated by using the antibiotics as well. Antibiotics I don't recommend that, so you shouldn't use forever. Of course when you wanted to treat for the acupuncture treatment, of course it is recommended, but when there is the infection is there, is that particular time it is essential to take the support of the modern medicine for 3 to 5 days to subside that infection. Later if at all problem is there, to be continue the follow-up treatments by acupuncture as well. No, I only treat by everything. Of course that is also possible. When there is a severity is there, that particular time their infection is there, that shouldn't further rapidly grow and then further shouldn't cause the much problem. later it will take the longer duration to get the recovery. The without problem we are taking antibiotic that the good bacteria and good cells also destroys, but already there is a problem is there. There is an infection and inflammation you can see in the naked eyes. Then it is essential to provide the medicine that also required, but you are not eligible to provide because there are the numerous antibiotics are existing. The gram positive medicines are required, gram negative medications are required, or the amoebiotic medicines are required, or some other cephalosporin derivatives are required, or the quinolin derivatives medicines are required. So some kind of the medicines which is essential to that particular problem. You understand, above the neck it is the gram positive bacteria medications, antibiotics are required. The below the neck region, that's called as a lower respiratory tract infection, or anywhere in the skin infections, that's required the gram negative bacterial medications are required in generally. But emergency, to know about the medication is no harm. For emergency, even homeopathy practitioner also prescribe the emergency medicine only for emergencies, called to save the life. Even Ayurveda doctors can prescribe the modern medicine because they also study the pharmacology and then the pharmaceutical, maybe one subject in the respective studies. Whoever studied the pharmaceuticals and then pharmacology in the respective subjects, they know about the drug. If they know about the drug, emergency certainly we can use for emergency conditions. Now we are talking about the ear. I'll try to give the comparison to the ear. Sir, how can be possible? How the kidneys are supporting to the ear system? At the age of greater than 60 years, naturally it diminishes. The vision diminishes, right? So now you try to understand, the bones are regulated by the kidneys. The bones are not so strong as much is required at the age of 60 years because the life goes on. It is declining the energy of the kidneys. The bone energy also declines. The sexual energy also declines. Then the ear energy also declines naturally. At the age of 70 years, 80 years, obviously they have the problem. That particular time they shouldn't feel that, oh, they do have the problem, like, ear is not very clear or something like that. But it's the natural, try to understand the natural cycle of the human being, because at the age of 56 years is according to the scientifically proven that the person have the good energy that till 56 years. The woman having the abundant chi, that to be known as a 49 years. Do you know the cycle of the each and every men and women? How many members knows the woman cycle? Every woman having the 7-year cycle, every man having the 8-year cycle. So based on that perspective, 49 years, the earth passage closes of the woman. There is no more conceiving to be taken place. At the age of 59 years, the earth passage declines. Whatever the chi and then energy and then su and essence are existing with the men, 56 years is completed. But later stages, of course, another 7, that means 62 years plus another 8 years, 70 years, that will be the bonus for you. The way of intellectuality, the way of thinking, the way of living, the way of eating, the way of the wife is supporting you, the understanding each other, that will take you to 70 years. Till 56 plus 7, 56 plus 8, 62, right? 62 years, if you will get the good energy, that means really you are very fortunate. But 70 years, you are the super fortunate, but with the support of wife. If the wife is not supporting you, but your energy will be totally declined. Because always I remember, always I understand, because the male required the female support and then elevation and then stimulation or provoking, invoking is required. If that's not there for the female also, 49 will going to decline. There is no more. The menopause starts at the 49 years, then slowly will start the atrophy of the organs. When the atrophy starts, then the estrogen and progesterone drastically will decline. Then there is no more strength in the reproduction. But don't ask me in the Rajasthan, 70 years old woman got the baby, right? That is a different stories, right? But in the naturally I am talking about that. But years also supporting you up to maximum level 56, 60 years, 62 years. Later of course your energy naturally will decline. That is the natural cycle of the universal law. Says, no sir, the person is coming, even he says that 70 years old, I wanted to increase my energy. Then I ask you, go and increase your female partner energy. It is required, she will increase your energy. Because it is intercommunicating. There is a touch, there is a sensation, there is a feeling that is never, no one can explain that. The love and then affection, that will increase the enthusiasm about the sexual activities. Not only in terms of the sexual activities, that should be pleasantable feeling always. When we talk only doing the coitus and that will make me pleasantable, is not like that. Doing the intercourse is not quite enough, but understanding each other, talking to each other, listening to each other, seeing to each other, touching to each other, that itself feels the pleasantable, that feels the harmony, that feels the happy, that feels the blissful, that feels the peace, which is really required. Now you understand, open into the years, but at the age of 50, 60, 70 years, at the age of 10 years child, having the problem, also then you understand it is essential to treat for the renal system. So when I talk about the points, then I'll tell you what are the points are recommended to apply the needle to enhance the energy of the ear system. Then when come to the manifestation on the hair, the manifestation on the hair also connected to the scalp hairs and then body hairs. Body hairs are protecting to the entire body system. Scalp hairs are strengthening to the scalp hairs are strengthening to the, of course, is the head region. But this is the lower portion. The lower portion, of course, the skin protection to be taken place. How the eyelashes are there, that is protecting to our eye system. How vibrissae is there inside the nose, that's protecting to the nose system. Scalp hairs is protecting to the scalp, and then this is the body hairs are protecting to our body system. Now hairs are connected to the, now here two ways I try to make you to understand why the scalp hairs are falling. Perhaps it is related to the, connected to the hormonal imbalance as well. The hormonal imbalance are regulated by the kidneys as well, right? You look at about the reproductive system, the pelvic system, the sacral system, the holy bone, to be known as a sacral bone, all are the pelvic girdle connected to the reproductive system. So that reproductive system, where the ovaries are there, in the pelvic organs. The pelvic organs are regulated by the renal system and then vesical organ. So both are connected to the water element. So therefore this is in fact is connected to the scalp hairs. Scalp hairs, when the ovaries are not good in terms of the regulating the hormones, then you understand it is connected to the scalp hairs also, where we called as a alopecia. Alopecia areata, alopecia totalis, alopecia universalis. There are the two different words. But alopecia areata or only alopecia, it is connected to the minimum fall of the hairs. Around 20 to 30 hair fall is there, or 30 to 40. That also to be known as a normally hair fall. that chances are there that certainly will come back to the again. If more than 100 or greater than 70, 80, 100 hair fall is there, so that is matters, but certainly there is some problem in the pelvic organ. At the same time, it is connected to the hormones as well, or there is some kind of the water get changes also leads to that problem. But however, basically according to the traditional medicine, the scalp hairs are regulated and controlled by the one particular organ to be known as a kidneys. When the kidneys are good, then the scalp hairs also good. In the scalp hair there is no hair fall much, but hair fall is more and more, then you understand there is the root of the energy of the scalp where there is very weak. The nutrition of the scalp inside there is a very weak, because the kidneys are not nourishing to the scalp. As I told you, the sea of the marrow to be known as especially with the connecting to the kidneys, so that kidneys are not supporting to the scalp region in terms of the supplying the chi. So therefore we understand the scalp hairs are, now you don't say if somebody is coming to you, that woman or lady, that girl, so hair fall is there, immediately you shouldn't put a word that kidneys are weak, right? This should be very careful. Then you understand there is the hormone changes, or you can mention, you can show like this area you having the weakness. Just mention this area, the back area, and then the lateral side of the lumbrical region, and then the pelvic region. The chi level is deficiency in this particular region. They understand. Don't signify that the kidneys are weak. Everybody doesn't know kidneys are here, right? So, but you just mention this area is having the problem. So hopefully in that way you just maintain, but activating certain points on the kidney meridian points that will support to the scalp hairs as well. Now we try to understand about the house of the willpower. House of the willpower and controls the two lower orifices. When the willpower is there, the person is, do you know the emotions? The positive emotions and the negative emotions. The too much emotions are there. So that particular time when who are closer to you, then you just go to that place and loudly you just cry in front of them, the emotion goes away. When the person is very sad, sorrow, then that particular time you just go and laugh somewhere loudly, then your sorrow go off, your emotions will get decline. That means this is not my words, this is the Greek traditional medicine says. So therefore whenever we feel that there is a sorrow or the fear complex, especially the inferiority complex that is connected to the kidneys. Now the kidneys are elevating our willpower. The fear has gone, the anger has gone, the anxiety has gone, the sorrow has gone, then the ego is no more, then your willpower will be very strong. The willpower need to be strengthened. Then you understand you need to strengthen to the renal system. There are the two most powerful lovable points to be known as one point to be known as a chu chi, the other point to be known as a tai chi. Both the points are really good to regulate our willpower. When the willpower to be strong, that to be required to fight against the infections and also strengthen our immunity as well. Then the control the two lower orifices. What are the two lower orifices? One is the lower orifices to be known as a urethra, and then the anal rectum. Urethra and then anal region, both are regulated by these are the kidneys. So rectum and then anal region are connected to the colon. How are you communicating to the kidneys? But of course, traditional medicine says that the kidneys are regulating and controlling to the rectum, sigmoid colon, and then rectum. So sigmoid colon is the part of the large intestine, and then the rectum also same, but the rectum, the anal fissures and then piles related problem can be treatable and regulated by the kidney system, making the cooling effect to the colon, making the cooling effect to the lower extremities. Because the kidneys are existing on the because there are the three geos, upper geo, middle and lower geo. The lower geo organs comes under the renal system. Renal system, colon, large, small, and then the para orb of the uterus, para orb of the pelvic organs are regulated by the renal system. So therefore rectum also connected to the kidneys, but therefore there are the certain possibilities are there, points are there, which points to be regulated. I'll try to tell you that. But at the same time, it won't control the lower orifices, is the hollow spaces, foramina. So those particular area, when it gets the contraction and then dilatation, relaxation, if it contracts all the time, it won't open. You ask the person who having the constipation, and he says, so to open the anal canal, he push the hand finger inside direction to open the anal region to come out some kind of the defecation. It's not super simple. It's very, very horrible on that particular situation. And in the lifetime, everybody will get one experience related to the piles problem, right? Burning sensation, difficulty, passing the stool, something like that. That is related to the renal system. But there are the two ways, because this is the involuntary orifice and then voluntary orifices. The mind is giving the control on it, and then the voluntary control on it. Voluntary control to open the anal sphincter, but you are given the command to that, but the mind is not yet given the command to open the anal sphincter, anal opening. So that time what happened? Why we spend half an hour? Some people will open the book and then study in the bathroom. Once the people take the textbook, they'll study on the washroom, right? So some of the people who have the constipation, I think the WhatsApp University, Instagram, Facebook, they will watch in the washroom. When sit comfortably on the WC, Western come out and comfortably, that is the place, is the where without any disturbances, and no one will knock the door, because if it is at home, when you go to the public toilet, even the half an hour queue line, when I visited to Hajj pilgrimage, that time 30 minutes we spend at time, sometimes it's 20 minutes we spend at time in the queue line. So much, millions of the people, right? So in that way, so much rush. So there we don't get the time, but at home, no one will disturb, will sit comfortably to read the books, because we are not giving the command. That means the command, think and then give the command to the anal canal. This is the key. When you wanted to sit, the purpose, why are you sitting on the washroom? So think in that way, the colon will support to open. Think about the small intestine, the cecum. From the cecum, think about the ascending colon. Think about the transverse colon, your stool, because it is the 5 meter long. It is a long. Where it is accumulated, we don't know. So think about the ascending colon, think about the transverse colon, think about the descending colon. The stool is passing in this way and descending to the downwards direction. Now it's coming out, then the stool also comes out. But your thought process is somewhere, your thinking is somewhere, your focus is somewhere, but you are sitting on the come out. Then how is it possible? So therefore, the mind should give the signal to the internal sphincter of the anal region to open that. Once it open, then the stool passes easily. But another problem is we don't provide, because as I told you, we are very very कंजूस. कंजूस को क्या बोलते हैं इंग्लिश में? हाँ? सेल्फिश क्या? माइसरली. गुड, ये सिखा दो मुझे. ठीक है, स्पेलिंग के साथ लिखो दियो, मैं सीख लेता हूँ. ठीक है. So that is, they don't drink the enough water, they don't nourish to the colon. Yes or no? So nourish with the water, that will evacuate precisely. So because the kidneys, what is required to the kidneys? The person who drink the water maximum around 8 to 10 glasses of the water in a day to nourish to the kidneys. If the kidneys are good, your essence also good, your bones stamina also good. The people who are suffering for the bone related problem, spondylosis, lumbar spondylosis, osteoarthritis of the knees, all are also one of the reason they don't drink enough water to them. When the water is deficiency, osteophytes, bones will get barriers, bones will get the obstruction. Where there is a tree is there, on the tree there is no water, you can see the bark how it is seeing. So in that way the bones also will become very weak. So that's causing the problems related to the bone. So therefore it is essential to drink the water. Water also is a medicine. Give the enough water to the human body system, that also required. If the colon, the lower orifices are regulated, urethra, I told you, urethra should be past the urine, because the urine also there is a toxicity is removing from our body system. The defecation also, it is eliminating the toxins from our body system. Perspiration also, it is eliminating our body system. But if that's not happening, that is accumulating inside the body system, which leads to the health disorders. When we understand about the water, the chi governing the water, orifices, the kidneys are the lower portion. The kidneys are the lower portion, the lungs having the upper portion, the lungs and then the kidneys governing each other, because the kidneys are the mother. The kidneys' mother is lungs. The lungs is supporting to the sun, that is the kidneys. When this together is governing the water nourishment or the exchange of the oxygen to be taken place between these two, the energy descending the downwards direction from the lungs to the kidneys, that to be taken place, that governing to be taken place. That's not happening. The regulation, the direction of the chi is not maintaining precisely. That particular time, which leads to the problem of the lungs problem. The lungs problem is not the reason of the lungs disorders. Remember, this is the very key important. The problem is are the kidneys, which causing the problem in the lungs disorders. When the kidneys are not nourishing and taking the energy or accepting the energy of the lungs is providing the energy to the downwards direction, pushing the energy to the downwards direction to the kidneys to accept the energy. When the kidneys are not accepting the energy, that means the kidney is over counteracting on the lung system. The kidneys are rebellions of the chi to the upward direction, that leads to the shortness of breath, that leads to the breathlessness, that leads to the cardiac problem, that leads to the cardiac asthma, that leads to the respiratory asthma, that leads to the bronchitis, that leads to the bronchioles get infected. Because that it is required. You communicate according to the 5 elements theory. The lungs are essential to provide the energy to the kidneys. Of course, the lungs is giving the energy, but the kidneys are weak, that's not accepting. But at the same time, when the lungs are not weak, Because the lungs are weak, that's not nourishing to the kidneys, because the malposition or the malfunction of the spleen, which is the mother for the lungs, is the spleen and then pancreas. The spleen and pancreas are weak. Due to that reason, we consume a lot of water. Due to that lot of water, that will not absorb, that will retention in the form of the phlegm, and that phlegm is stored in the form of the unwanted substantial phlegm is stored in the container. That container to be known as the lungs. Three organs are equivalently very, very crucial for this three, lungs, spleen, and then kidneys are in one row. It is essential to regulate the overall the respiratory system, cardiac system, water metabolism, bone system, and then this the urinary system. So if these three concepts are weak, then you understand all are connected to this problem. Then you look into the digestive metabolism is not good. Due to that reason, the lungs is getting the stored of the phlegm, because the spleen is producing the more phlegm. The phlegm is not only producing the lungs, the causative factor of the phlegm to be known as a spleen. Minimize, decrease. That's the reason there are the 2 points, thigh poi and then fenglung. Both the points are regulated to regulate the phlegm. The phlegm dispelling point to be known as a fenglung, that is stomach 40. Thigh poi is the spleen 3. One is the source point, the other one is the luvo connecting point. The best point to treat for the lungs should receive the energy of the kidneys, that point to be known as a folio, that is K7. This is something is amazing, right? Now we look into the gate of vitality. I love this point because this is something is the very, very imperative point. So gate of vitality, that point to be located just distal to the second lumbar vertebra. Do you know the Shen Shu Si Shi? Shen Shu, Mingmen, Shen Shu Si Shi, DU4, UB23, UB52, and then Chingmen. Chingmen is gallbladder 25. These are the 4 points. You keep it in the mind. Really, I love this combination, this protocol. Whenever you find that there is the kidney related problem is there. So to strengthen the kidneys, there are bilaterally 4 points you just activate as a local points. DU4 and then Shenshu UB23, Sishi UB52 and then Chingmen GB25. These are the 4 points. Exactly that is located on the kidneys as well. One is the superior kidney, one is the middle kidney, the other one is the deeper kidney level. You just focus all these 4 points, that will be really strengthening to the renal system. This just as a local points. Other points, many points are there, but is a different. The Ming Men, as I told you, the Ming means is the vitality. Men means is the gate. Right. So this is, in fact, is the place when we look at about the at the time of the conception, the implantation of the fetus. So that particular time after the 2 months, the extraordinary vessels, this is controlled and this is producing at the time of 2 months of the child itself. The fetus is at the 2 months, that time that's called as a reservoir medicines. I think I told you very long back, I think Reserve Bank of India is there. Like that, the reservoir meridians to be known as a extraordinary meridians. Those meridians are regulating at the time of 2 months of the implantation. After that, at the time of the birth, after 9 months, the energy, the 8 conceptual vessels or the 8 extraordinary vessels combine together and then meet each other at the place of the Mingmen. From the Mingmen, it ascends the upward direction that communicate to the kidney. After the communicating to the kidney, that ascends to the upward direction, energy through the spinal cord communicating to the brain system. Such a powerful point. When the person is at the age of 80 years, you wanted to treat is one particular point. You just provide the very strong substantial moxa, good quality of the moxa. So strengthen this particular point. The energy will be very, very good. Do you know the central point of the ventral side of the body to be known as a thigh yi? That is the thigh yi. Which point? Sometimes I'll forget the name. Thigh yi, stomach 23. Then you understand the back of the point, the central point of the body to be known as a Mingmen, that is DU4. DU4 point. I'll try to tell you more information about the Mingmen. You understand the right side of the kidney to be known as a Mingmen. You keep it in the mind. Left side is the proper kidney and then right side kidney to be known as a Mingmen. That's called as that also one kind of the function. The right kidney is good, then your sexual activity is good. The right kidney is good, then your development also good. And then left kidney is good, your water metabolism is good. And then the function of the kidneys are good. But of course these are both are slightly different, but it is combined together, having the integrated and also having the cumulative and synergy effect to regulate the entire system of the body, to support the vital organs in our body. Kidneys also to be known as a mother for all the organs, because it is also nourishing to brain, it also nourishing to the entire system of the body. When the good essence is there, through that essence only all the organs will develop and promote and regulate our body system, I believe. Right. Then quickly I'll just finish in a few minutes about the divergent meridian. Then I'll give you very short break, stand and then relax and collapse yourself, and then please be seated and immediately we'll proceed for the points. The 12 divergent meridian, that's called as a kidney divergent meridian. So kidney divergent meridian, so there is a separating, entering, resurfacing and joining. The place where exactly this starts, you remember always when there is a divergent meridian is the muscular meridian. So this meridian starts always on the popliteal fossa. When there is a full meridian, that starts from the popliteal fossa. If it is a hand meridian, sometimes it starts from the cubital fossa, right? So now this starts from the popliteal fossa, then it ascends upward direction to the pelvic region of the back. From there it communicates to the kidney and then bladder. From there it ascends upward direction through the spine. From there is a communicating point to be known as a Tian Su, that is UB10. But it's not much important, you need not to worry about it. But sinus meridian also, you look at about this meridian called as a tendinomuscular meridian to be known as this is sinus meridian, right? So now this meridian starts from the sole of the foot on the small pinky toe. From the toe it encircles the navicular area of the arch of the foot. From there it ascends upward direction to the medial side of the foot region or medial side of the ankle region. From the ankle region it ascends to the upward direction to the knee. From the knee it ascends upward direction to the back region. From the back region it goes to through the supportive of the UB meridian spinal cord. From there it communicating to the Pai Hui DU20. From the DU20 is communicating to the throat. From the throat it is communicating to the chest region. This is one kind of the place. But one particular area I wanted to tell you, the point to be known as a Chung Chi. Chung Chi is the UB alarm point. Ren 3. Ren 3 is the place where there are the 3 hand there are the 3 hand sinews. Meridian is communicating point, not the foot meridian. That is pericardium, lungs, and then heart. 3 places. You remember there are the, when I take the Renmai meridian, you will love to that subject, love to that meridian, but this particular 2 points, but the entire area is the very, very super powerful point, but the 2 points to be known as the one is the Kuan Yuan, the other one is Chung Chi, Ren 4 and then Ren 3. These are the 2 places where the maximum energy, the lower portion of the energy known as a spleen, liver, kidney, pericardium, lungs, heart, communicating point to be known as these 2 points. So therefore it's very amazing point. So the later when I take that particular meridian will highlight. The Luo connecting point. So always you remember when the Luo means I told you is the passage, is the link between the husband and wife, link between the urinary bladder and then kidney together. So therefore this is communicating together, that point to be known as a, which is the source point of the, this is the Luo point is kidney, 4 is the Luo connecting point, which is the source point of the urinary bladder. I think Dr. Mirza always were completed the urinary bladder meridian. Totally 67 points was completed. Yes. UB 64. Chugu. Chinku, right. So there is a communicating together. There is a communication together. Urinary bladder points. My favorite urinary bladder meridian. So that is Changa Chinna Changa Shanga Fi Yanga Fu Yanga Kunulana Pushana Shenamai Chinnamana Chingo Shugo Sotongo Chayin. UB 55 to 67 points. This is the lower extremities points. Very, very amazing points. So that particular point called as a UB 54, Chinnaman Chinku, Chinku is the UB 64 point. You just use UB 64 and then the kidney 4 together is the combination to treat for the kidney and then urinary bladder related disorders. There is a link between the each other, we certainly activate together. So thank you one and all. Just we relax before going to the kidney meridian and then we will start quickly for the next meridian. What's the time now exactly? It is 12:30. 2 hours to say 6 functions. Wow, it's amazing.